The UK has become the first country to approve a new vaccine targeting the original strain of COVID and the Omicron variant in one jab.
Yes, the Moderna jab has been given the green light by the Medicines and Healthcare Products Regulatory Agency. It is due to be offered to the over 50s and care home residents from next month. We're joined now by the Vaccines Minister, Maggie Throup, who will give us more information on this. Good morning. Thanks for joining us this morning. So good news, obviously. We've got this vaccine that will now treat both variants. There isn't enough of it, though, is there, to be able to cover everybody in the autumn booster programme? So how will it work? How will you prioritise who gets this?
Well, as we've always done with our vaccine programmes, we prioritise those most at risk, and that's the most elderly first, and those in care homes, those who have got certain clinical conditions. And I think it's important that we continue with that rollout in that order. I mean, obviously, the Moderna vaccine has now been authorised, the bivalent, which is really good news, because, as you say, it provides immunity against the original strain, the Wuhan strain, and against the Omicron variant. But, you know, obviously, we're getting stocks into the new vaccine actually this week, and we'll be getting further stocks as we go through the next few weeks. But there's other vaccines coming online as well. So we are quite confident that we'll be able to deliver the programme with a bivalent vaccine throughout the next few weeks.
Just to be clear, Maggie Throup, you mean Omicron, not Omicron?
Omicron.
Right, yeah, that's all right. I'm not correcting you on that, but there will be people out there that are concerned. If we can't pronounce the variant, we're also perhaps not clear entirely on all of the facts. And there are people out there, not least many care workers, who are concerned and sceptical about the vaccine, because we were told in the early days that 2 would work. Now it's extended into boosters. Now we've got a new vaccine. And people out there need that confidence and need to be persuaded that this isn't just going to be a bonanza for the drug companies, that this new vaccine, the one dose, is going to have some meaningful effect, especially when out there people are perfectly aware that despite the vaccine rollout having been successful, we know somebody up and down the country that's got the disease.
Yes, I think one thing that's obviously been predictable about this virus throughout the whole time is it is unpredictable. And we also know that immunity wanes over time, against the different variants, and that's why we need to boost people. And it is a booster, boosting people's immunity. And the tests have shown on people of all ages that over time that immunity is waning, and we need to make sure that we give everybody the best possible chance of not getting severe disease, not being hospitalised, not being on intensive care. And it's important that people do come forward for their booster as soon as they get that invite from the NHS or from their GP. And I think at the same time, it's important for people to know that they'll be able to get the flu vaccine, and where we can co-administer the 2 vaccines at one time, then that's going to be really helpful.
I think that's probably right. Listen, a lot of people out there want to have confidence in the person who's responsible for all of this. And listen, it's not just me. I asked around. There's some people who are quite kind of politically engaged. They're anoraks. We used to have Nadim Zahawi on this show all the time. And you've been a bit like the kind of political Scarlet Pimpernel. Nobody's been able to get you on telly, certainly on GMB. Why are you so media shy of coming on to talk about this?
Well, I think that's not quite correct. I mean, I've been doing media rounds for since I was appointed Vaccines Minister. I'm sorry I haven't been on GMB before, but I'm here now. I've done other outlets throughout the whole time, and I think it's important that we do get our message across. But I think I also want to give credit to the millions of people who come forward for their jab.
Sorry to interrupt. It's just a matter of time, and I don't want to be rude to you. It's very important you understand. It was 100 days after being appointed Vaccine Minister that you actually came on telly. Can I just ask you this? There's 26 million people that are going to get this vaccine. That's a lot of NHS resources. Again, people support the vaccine. It's been a success, to be sure. But the impact of lockdowns and COVID and on NHS resources has meant that cancer treatment, certainly treatment for mental health resources and services, are a complete disaster. Waiting lists have gone up. How can you guarantee, as part of the Department of Health, that it isn't going to get worse as a result of this new rollout?
It's exactly why we're asking people to come forward when they are invited. And it's important that people do boost their immunity, especially those most at risk of hospitalisation. And that's one way we will prevent hospitals being overrun over the coming months. It's part of our programme to ease the winter pressures on our hospitals. Our NHS staff play a hugely important role, and they have done throughout the pandemic and before. We need to do whatever we can by coming forward for our jab to make sure that those healthcare workers can continue treating those people with cancers, with heart disease, who've had strokes, and make sure that that we're protecting ourselves and helping others as well.
Can we pick up with you on the cost of living crisis? There's increasing pressure to hear something from the government about the action that's going to be taken. We hear that we have to wait for the new Prime Minister to be in position for that to happen. But for so many people who already can't afford their energy bills, and we know that this is only going to get worse, they're very keen to hear what measures there are going to be. We know that Boris Johnson's on holiday again for the second time in 2 weeks. I mean, why is he on holiday now? He's going to have all the time in the world, isn't he, in just a few weeks' time?
Well, yes, MPs, we have responsibility in Parliament, and recess will be over in I think, about 3 weeks' time. But coming back to what we're doing to support people with the cost of living situation, and we've already put together a package of £37 billion that is being rolled out. There's lots of different aspects of that, helping pensioners, helping those on low pay, helping people generally. And, people haven't seen the full extent of that.
Yeah, because we know that's based on outdated figures, isn't it? And the price cap's going to go up even more than when those figures were assessed.
Aren't you also supporting, aren't you also supporting Rishi Sunak, who's been completely unclear on what his policy is going to be? It was announced yesterday by Labour. You'd want him to have a clear policy to protect not least the most vulnerable. That's part of your mission as a politician, isn't it, Maggie Throup?
I think it's quite right that we wait until we know who is our new leader and Prime Minister, and then they will take on a lot of advice about the latest situation. I mean, only last week the Prime Minister, the Business Secretary and the Chancellor met with energy companies, and it's that sort of talking, and also the civil servants putting together different options to put in front of whoever is successful on the 5th of September to make sure that very quickly the messages, we know exactly how people are going to be helped. And I have every confidence that whoever is leader will put together a package that really does support people.
But do you not think the two leadership candidates should not come together, have a meeting, make a decision, or should Rishi Sunak step aside? The polls at the moment are consistently saying that he's so far behind.
The country's in crisis, Maggie Throup. You can't be the first person to know this.
Look, I think it's quite right that we wait for the outcome of the election. I said we haven't got long to go, and I don't think any candidate should stand down, because until we know the actual result on the day, then everything's to play for.
OK, Maggie Throup, their Vaccines Minister. Thanks for joining us this morning.